Hey everyone, welcome to the podcast. This is pB&J podcast. I am Jacob Cruz, and I'm here with
Brian.
Today we're going to be discussing a very important human health hazard, hepatitis.
Hey, what is hepatitis?
Well, that is a great question. You see, it's a biological human health hazard. Heavy alcohol use, toxins, some medications, and certain medical conditions can cause hepatitis. However, hepatitis is often caused by a virus. Refers to the inflammation of the liver caused by the viral hepatitis virus. So no, it's not a part of a dirty dozen. There are 5 main strains of hepatitis virus, referred to as type A, B, C, D, and E. While they all cause liver disease and they differ in important ways, including modes of transmission, severity of illness, geographical disruption, and prevention of methods. Some types of hepatitis are preventable through vaccination. So, hepatitis A can spread from close personal contact with an infected person, such as through certain type of sexual contact, caring for someone who is ill, or using drugs with other. Hepatitis A is very contagious, and people can spread the virus before they feel sick. Frequent hand washing with soap and water after using the bathroom, changing a diaper, and before eating or preparing food can prevent a spread of hepatitis A. The best way to prevent hepatitis A is through vaccination with a hepatitis A vaccine. So now let's talk about hepatitis B. Hepatitis B is a spread when blood, semen, or other body fluids from a person infected with the virus, when the virus enters the body, and someone who is not infected. This can happen through sexual contact, sharing needles, syringes, or other drug injection equipment, or from mother to baby at birth. There is not many medication threat acute hepatitis B for people with mild symptoms. Healthcare providers usually recommend rest, adequate nutrition, and fluids. Those with severe symptoms may need to be hospitalized. The best way to prevent hepatitis B is by getting vaccinated. The hepatitis B vaccine is safe and effective. You need to get all shots in the series to be fully protected. Hepatitis C is the spread through contact with blood and an infected person. Today, most people infected with hepatitis C virus by sharing needles or other equipment used to prepare or inject drugs. Over 90% of people infected with hepatitis C can be cured of their infection, regardless of HCV genotype, with 8 to 12 weeks of oral therapy. There is no vaccine for hepatitis C. This is the best way to prevent hepatitis C is by avoiding behaviors that can spread disease, especially injecting drugs. Getting tested for hepatitis C is important because treatments can cure most with hepatitis C in 8 to 12 weeks. Symptoms of hepatitis A, B, and C may include fever, malaise, loss of appetite, diarrhea, nausea, ammonia, discomfort, dark-colored urine, and jaundice. In some cases, the virus can cause the chronic liver infection that can later develop into a psoriasis or liver cancer. These patients are at risk of death, and an estimated 354 million people worldwide live with hepatitis B and C, and for most testing and treatments remain beyond reach. Hepatitis D, HDV, is only found in people already injected with hepatitis B, HBV. However, a dual infection of HBV and HDV can cause more serious infections and poor health outcomes, including accelerated progression to psoriasis. Development of chronic hepatitis D is rare.
Hepatitis E, or HEV, begins with mild fever, reduced appetite, nausea, vomiting, lasting for a few days. Some persons may also have abdominal pain, itching, skin rash, or joint pain. They may also exhibit jaundice with dark urine and pale stools and a slightly enlarged tender liver, or occasionally acute liver failure. HEV is usually spread by the fecal-oral route in developing countries, where HEV genotypes 1 and 2 predominate. The most common source of HEV infection is contaminated drinking water in developed countries. Sporadic cases of HEV genotype 3 have occurred following consumption of uncooked or undercooked pork or deer meat. Hepatitis E usually resolves on its own without treatment, There is no specific antiviral therapy for acute hepatitis E. Physicians should offer supportive therapy. Patients are typically advised to rest, get adequate nutrition and fluids, avoid alcohol, and check with their physician before taking any medications that can damage the liver. Hospitalization is sometimes required in severe cases and should be considered for pregnant women. Prevention of hepatitis E relies primarily on good sanitation and the availability of clean drinking water. Travelers to developing countries can reduce their risk for infection by not drinking unpurified water. Boiling and chlorination of water will inactivate HEV. Avoiding raw pork and venison can reduce the risk of HEV genotype 3 transmission. No FDA-approved vaccine for hepatitis E is currently available in the United States. Through vaccination, we are maintaining and regulating the spread of this health hazard. If you want to learn more, visit www.cdc.gov/hepatitis.
Thank you for looking at the podcast. This is pB&J podcast. I'm Ryan.
I'm Jacob.
We switch names.